Imagine a world where just walking, climbing stairs, or even getting out of bed doesn't bring that awful grinding pain. For, well, literally hundreds of millions globally, that's just not their reality. They live daily with knee osteoarthritis. And it's a condition that doesn't just affect the joint, does it? It fundamentally chips away at the quality of life. For far too long, our standard approaches, while offering some help, they've mostly been temporary fixes. Fleeting relief from corticosteroids or hyaluronic acid injections that need constant top-ups. The real challenge has always been, how do we give people truly long-lasting, genuinely transformative relief? Not just managing symptoms, but really enhancing their functional life. Welcome to the Deep Dive. Here we explore the critical innovations that are reshaping medicine and patient care. Today we're focusing on a potentially groundbreaking new treatment option that seems poised to redefine how we manage knee osteoarthritis. And guiding us through this complex but actually incredibly hopeful area is Professor Mo Imam. He's a truly distinguished figure in the orthopedic world, known for his extensive work with novel therapies and his really deep clinical insights into joint care. Just the expert we need, really, to help us get to grips with this innovation. Okay, let's try and unpack this then. To set the scene, could you start by briefly defining Arthrosamid for us? What's its core purpose in the sort of a wider picture of knee OA treatment?
Certainly. Arthrosamid is, well, it's a novel intra-articular hydrogel. Intra-articular meaning it's injected directly into the joint space itself. It's a polyacrylamide hydrogel. And its core purpose is to provide genuinely long-lasting pain relief and, crucially, significantly improve joint function for people suffering with knee osteoarthritis. You should probably think of it as perhaps a significant evolution in our non-surgical options. Moving beyond just transient relief towards something offering sustained, durable outcomes, it's specifically designed to integrate within the knee, offering enduring lubrication and mechanical support.
That phrase "long-lasting" immediately jumps out. Given the limitations, the shortfalls of existing therapies we've touched on, what, in your view, was the most significant unmet need that Arthrosamid was really designed to tackle?
The primary unmet need, without a doubt, was the duration of effect and the ability to offer a genuine, sustained improvement in joint health without needing repeated, often quite burdensome, interventions. For decades, you see, traditional injectables have locked patients into this cycle. Temporary relief, then that frustrating return of pain, then another procedure. And that doesn't just burden the patient frequent clinic visits, the small but real procedural risks, it can create a sense of futility, can't it? Arthrosamid was engineered specifically to break that cycle. It offers a single injection solution that integrates with the body's own synovial tissue. It provides enduring lubrication and this cushioning effect. So it fundamentally tackles the root problem of joint friction and wear in a much more persistent, a much more profound way than anything else we've had in this category before.
That really does sound like a shift in approach. And just one more thing to set the scene. What's one particularly surprising characteristic about its composition that makes it stand out from the more conventional injectables we're used to?
Without question, it has to be its non-absorbable and non-migratory nature. Unlike pretty much every other injectable substance we use in orthopedics, especially hyaluronic acid, arthrosamid isn't broken down or absorbed by the body over time. It actually establishes itself within the joint capsule. It forms a continuous, stable matrix that provides ongoing mechanical support and lubrication. And that distinction is absolutely critical. It means we're not just temporarily topping up a fluid, we're establishing a lasting, integrated component within the joint, something that contributes to its sustained function and pain reduction. It's quite revolutionary in that sense.
Okay, so to really appreciate where arthritis came from, we need to understand that urgent clinical need behind it. Considering how widespread knee osteoarthritis is globally, why was developing something like this so critically important?
Well, the urgency really stems from the sheer scale and the impact of knee OA. It's not just a common condition. It is, frankly, a global health issue, a major one. We're talking about a degenerative disease that profoundly impacts the quality of life for hundreds of millions of people around the world. Patients face, debilitating pain, stiffness that really restricts their day-to-day lives, a significant loss of mobility, and that can lead to social isolation, even impact mental well-being quite severely. And while traditional conservative treatments, physical therapy, exercise, weight management are absolutely fundamental, they are the cornerstones of care, they often prove insufficient, especially for patients with moderate to severe symptoms. You see many patients diligently following these strategies, yet they still find themselves in persistent pain, struggling with simple everyday tasks.
Right, so the standard approaches just weren't enough for many.
Exactly. And then when you look at the existing injectable therapies like corticosteroids and hyaluronic acid, their relief is, almost by definition, transient. Corticosteroids, yes, they can offer rapid pain reduction, which is certainly valuable for acute flare-ups. But the effects are typically short-lived, often just a few weeks, maybe a couple of months. And moreover, repeated steroid use carries well-known risks. Potential systemic side effects like increased blood sugar, a real concern for diabetic patients, and local risks too, like potential cartilage damage or weakening of tissues around the joint over time.
And hyaluronic acid, that's meant to help lubrication, isn't it?
It is. Hyaluronic acid injections aim to replenish the viscoelastic properties of the synovial fluid, the joint's natural lubricant. However, HA is a naturally occurring substance, and crucially, once it's injected, it's biodegradable. This means the body's own enzymes, particularly hyaluronidase, break it down, typically within a few months. So you need frequent injections, sometimes every 3 months, just to maintain the effect. This constant cycle, temporary relief, return of symptoms, need for another procedure, it highlights this massive gap, this shortfall in truly effective long-term non-surgical options. Arthrosamid really emerged directly from that critical unmet need. The search for something that could offer sustained, meaningful improvement without being absorbed or needing constant readministration.
That really does paint a clear picture of the gap it was designed to fill. And how did that translate into its journey through clinical investigation? I understand it started gaining significant traction around 2018.
That's right. The initial clinical investigations into Arthrosamid's potential really kicked off around 2018. These were initial observational studies, proof of concept cohort studies, and those early findings were incredibly promising. They indicated positive outcomes for pain reduction and improved function, suggesting it could be a viable, long-lasting alternative to the established but limited treatments. Then a really pivotal moment came in 2021 with the publication of comprehensive long-term follow-up results. This is from a 5-year prospective study, and the results were, well, quite remarkable, actually. They showed sustained pain reduction and improved joint function in patients for up to 5 years after just a single injection.
5 years from one injection? That's
Yeah.
significant.
It really is. And that long-term efficacy truly grabbed the attention of orthopedic leaders and innovators. People like Rakesh Taylor, the CEO of the Contura Group, the developers, have been quite vocal, emphasizing the treatment's potential to fundamentally redefine knee OA management. They particularly highlight the importance of making it accessible to a wider patient population. This whole progression really underscores a global effort to enhance the treatment landscape for OA patients, moving towards more durable, more impactful solutions. As we're talking now, in 2023, while Arthrosamid isn't yet widely covered by national health services, say like the NHS here in the UK, private clinics across Europe and increasingly elsewhere have begun offering it. And that reflects a growing acceptance, doesn't it? A strong demand within the medical community for genuinely effective, long-lasting options, even while those broader regulatory pathways are still being navigated.
Okay, let's delve into the science now. The unique blueprint of Arthrosamid, which seems to be the core of how it works. You've stressed it's not just another injection. What makes its physical makeup so distinct, and how does that translate into its action within the joint?
Indeed, it's far more than just another injection. Its distinction lies squarely in its very precise, unique formulation, which is quite elegant, actually, in simplicity. It consists of 97.5% non-pyrogenic water. That means it's meticulously purified, free from any fever-causing agents, absolutely crucial for intra-articular safety, and just 2.5% cross-linked polyacrylamide. That specific composition is the key to its persistent effect. When it's injected, this hydrogel effectively integrates with the synovial tissue, the lining inside the knee joint. It forms a stable, persistent layer. This integration allows it to provide a continuous, lasting cushioning effect. And that's vital for minimizing friction and wear on the joint surfaces when you move.
So it's not just acting like a temporary lubricant that eventually gets washed away. It actually becomes an integral working part of the joint's environment, almost like a permanent internal shock absorber.
Precisely.
Yeah.
That's a good way to think about it. The cross-linked polyacrylamide forms a stable, three-dimensional structure, often described as a honeycomb structure. Can-do. This structure is very specifically engineered. Its microporous architecture allows it to integrate efficiently with the synovial membrane, yet it maintains remarkable elasticity. It's not a rigid implant, but a dynamic, biocompatible scaffold. It can flex and absorb forces within the joint, a bit like healthy cartilage, but without being a biological replacement itself. It essentially enhances the viscoelastic properties of the joint fluid and provides that sustained physical buffer. There's even some preliminary research suggesting this scaffold might encourage a favorable biological response or stabilization within the knee environment, though a further work is definitely needed to fully understand those intricate biological mechanisms. That's an ongoing area of intense interest.
And the high water content, that contributes to the gel-like feel.
Exactly. The high water content gives it that gel-like consistency, which significantly enhances joint lubrication and directly supports the mechanical function of the joint. It ensures the articulating surfaces glide smoothly over each other. This gel-like matrix is fundamental to its remarkable durability and persistence. Now contrast that with traditional hyaluronic acid injections. As we discussed, they're biodegradable. The body breaks them down enzymatically over time, which is why you need repeated injections. Arthrosamid, by stark contrast, is non-absorbable and non-migratory. It isn't broken down, and crucially, it stays exactly where it's injected within the joint capsule. So it provides sustained cushioning and protection for the inner joint surfaces, offering prolonged relief without degradation, or, importantly, dispersing to other areas. This unique physical chemistry truly sets it apart. It allows it to address the symptoms of knee osteoarthritis with both immediate and remarkably prolonged efficacy. It really offers a new frontier in joint preservation and symptomatic relief.
Right, we've dissected the science, which is fascinating. Let's bridge that now to its practical use. Who really stands to benefit most from this approach? For our medical audience listening, what are the primary indications and the crucial patient selection criteria for arthrosamid?
Okay, so arthrosamid is primarily indicated for patients with knee osteoarthritis, particularly those experiencing moderate to severe symptoms. We're generally talking about individuals whose daily activities and overall quality of life are significantly impacted by their knee pain, and where, importantly, conservative measures haven't provided adequate relief. The main goal is to provide substantial, durable pain relief, significantly improve their joint function, and restore overall mobility, essentially allowing patients to regain a sense of normality and activity.
And how do you select those patients? What specifically are you looking for?
Patient selection involves a careful assessment, combining both clinical features and radiological evidence. Clinically, suitable candidates are typically aged 35 or older. They present with persistent movement-related knee pain, often stiffness after periods of inactivity, perhaps crepitus, that grating or crackling sound in the joint, and usually some limitation in their range of motion. Radiologically, we look for clear evidence of osteoarthritis on imaging, like X-rays. That means looking for things like osteophytes' bone spurs and characteristic joint space narrowing, which indicates cartilage loss and disease progression. Crucially, patients are generally considered suitable only when those traditional conservative measures have been properly tried and haven't worked well enough. So they should have diligently tried things like physiotherapy, regular appropriate exercise, weight management if needed, and maybe even fail to get sustained benefit from other types of injections. Also, the patient's commitment to the aftercare and rehabilitation process is quite important. We find optimal results are usually achieved through a holistic approach, not just the injection alone.
It sounds like a very comprehensive assessment is needed, not just looking at one symptom or one X-ray finding. And when you administer arthrosamid, what are the specific treatment goals you're aiming for, and what should patients realistically expect in terms of outcomes and the timeline?
Absolutely. That holistic assessment, factoring in their overall health, activity levels, expectations, it's paramount. The primary goals when administering arthrosamid are essentially threefold. First, to restore and enhance the lubricating properties of the synovial fluid. Second, critically, to significantly reduce that intra-articular friction. And third, to provide that sustained cushioning and biomechanical support we talked about. Taken together, this promotes much smoother joint movement, which directly translates into reduced pain and significantly improved function for the patient. That's the aim.
And in terms of expectations for relief,
In terms of patient expectations, we aim for profound and long-lasting relief from pain and a substantial improvement in their joint function. For many patients, actually, a single injection may well be sufficient to achieve these quite remarkable outcomes, providing relief for an extended period often measured in years, based on the data so far. However, it's really important to manage expectations realistically and be transparent. As with any medical intervention, individual responses can vary. Some individuals, perhaps those with very advanced disease or unique biomechanics, might potentially require a second injection down the line to achieve their optimal outcome. So the precise treatment plan must always be meticulously tailored. It has to consider the individual's specific condition, their lifestyle, their personal needs. It requires a thorough discussion and a shared decision-making process between the patient and their qualified healthcare provider. This ensures everyone's on the same page with realistic expectations and a plan that aligns with their goals for getting mobile again.
It sounds incredibly promising, but as you say, patient safety is always the top priority. No treatment is without nuances. What are the key contraindications and precautions that healthcare providers absolutely must consider before administering arthrosamid?
You're absolutely right to stress that. Patient safety is paramount. And while arthrosamid injections are generally very well tolerated, there are definite contraindications and crucial precautions we must observe. Firstly, any active infection at or even near the proposed injection site is an absolute contraindication. Introducing any foreign material into an infected joint carries a significant risk of causing septic arthritis, which can be a really devastating complication. So infection must be ruled out. We also need to exercise caution with patients who have certain systemic autoimmune conditions. These might predispose them to inflammatory responses. And of course, those with known specific allergic reactions to any component of the injection, however minute. A thorough allergy history is essential.
So checking for infection and allergies is key. Any other conditions to be wary of?
Yes, a careful and comprehensive medical evaluation is essential for any patient with underlying medical conditions that could potentially complicate the treatment or their recovery. This means a detailed review of their medical history, current medications, any comorbidities. Then, post-procedure, it's vital to monitor for potential side effects. These are typically transient and mild, like temporary stiffness, some localized pain, or maybe swelling at the injection site. These are usually benign and resolve quickly, often within a few days. However, rare allergic reactions, though uncommon, must always be considered a possibility. Patients need to be thoroughly advised on what signs to look out for, things like persistent or spreading redness, severe pain that isn't getting better, or fever. Vigilant monitoring ensures a safe treatment experience and allows for prompt intervention if any unexpected reactions do occur. That detailed pre-screening and proper patient education are absolutely key to minimizing risks and maintaining the highest safety standards.
Let's shift now to the practical side of things. How exactly is arthrosamid administered, and what does the post-procedure care involve to make sure patients get the best possible outcomes?
Okay, the administration itself is a minimally invasive procedure. It's typically performed in a dedicated outpatient setting by experienced clinicians who have expertise in joint injections. A crucial element, which significantly enhances both the efficacy and safety, is that the procedure is universally ultrasound guided. This allows for incredibly precise, real-time visualization. You can see the needle's path, and you can see the hydrogel being deposited directly into the intra-articular space of the knee. That precision is absolutely vital. It ensures the material goes exactly where it needs to, optimizing its cushioning and lubricating effect while minimizing the risk of accidentally injecting it into surrounding tissues.
So definitely not a blind injection then. That real-time view must provide a clear advantage for both precision and safety. Could you walk us through the typical steps a patient would go through?
You're entirely correct. It's an image-guided procedure, a significant enhancement. The process starts with thorough patient preparation. This usually involves administering a local anesthetic to the skin and the tissue just beneath it, around the injection site, to minimize any discomfort during the actual injection. Once the area is sufficiently numb, the doctor uses the ultrasound probe, not just to visualize the joint structures, the bones, the cartilage surface, the joint lining, but also to assess for any excess synovial fluid. We call that an effusion. If a significant effusion is present, that fluid might be aspirated, drawn off, before the arthrosamid is injected. This is often done to create the best possible space within the joint capsule and potentially remove some inflammatory fluid, which could enhance the effectiveness of the arthrosamid.
Okay, so prepare the patient, use ultrasound, potentially drain fluid, then the injection itself.
Precisely. Following that preparation, the arthrosamid gel is carefully and slowly injected directly into the joint space, guided by the ultrasound image. It's actually common practice and often recommended to also inject a small amount of steroid medication at the same time, or immediately afterwards through the same needle track. This is done primarily to mitigate any potential post-injection inflammatory response or flare-up. Sometimes the joint can react a little to the new material being introduced, so this co-injection helps ensure a smoother, more comfortable initial recovery period for the patient. Once the injection is complete, the needle is withdrawn, and the site is simply covered with a sterile dressing or a small plaster for protection. The whole procedure is relatively quick. Usually takes only about 15 to 20 minutes from start to finish, including the preparation time.
And after those 15-20 minutes, what does the patient need to do, or perhaps, importantly, not do, to ensure the best recovery and the optimal long-term benefit?
Post-procedure care is generally straightforward. but it is critically important for getting the best results. Patients are typically monitored for about 10 to 15 minutes immediately after the injection, just to ensure there are no immediate adverse reactions, which are very rare. The main advice then is to avoid strenuous activities and to consciously rest the treated knee for approximately 1 week. This period of relative rest is crucial. It minimizes the risk of inflammation or any initial flare-ups as the joint starts to accommodate and integrate the hydrogel. So patients should avoid high-impact activities, heavy lifting, or prolonged standing during that initial phase.
Okay, rest for about a week. And when can patients expect to feel the benefits?
That's a key point for managing expectations. While some initial benefits, perhaps a subtle reduction in discomfort, can occasionally be felt relatively quickly, sometimes within a few days or a couple of weeks, patients should understand that the more significant pain relief and functional improvement are generally observed around the 4-week mark. The optimal benefits often seem to peak around the 12-week mark. So having this timeline helps manage expectations and encourages patients to adhere to that initial rest period for the best long-term outcome. We usually advise patients to, listen to their bodies and gradually return to their usual activities, incorporating gentle, low-impact exercises as they feel able. Open communication with their doctor about how they're progressing is always encouraged.
Of course, the clinical data is what really underpins practice and gives us confidence in a new treatment. What do the studies consistently tell us about arthrosamid's efficacy and its overall safety profile?
The clinical evidence we have for arthrosamid is, well, it's robust and actually quite compelling. Clinical trial data consistently indicates significant pain relief occurring within just 4 weeks of administration. But what's particularly noteworthy and really a key differentiator is the sustained effect. Studies have shown these benefits lasting up to 156 weeks, that's over 3 years, and indeed, longer follow-up is ongoing. When we look at patient outcome data collected from various studies and cohorts, it suggests that approximately 80% of patients experience a significant improvement in their pain levels and their functional capacity.
80% is a high responder rate.
It is a very encouraging rate, and we've seen numerous anecdotal reports, which are consistent with this clinical data, of patients achieving really remarkable reductions in pain, sometimes even complete freedom from discomfort, which allows for a significantly restored range of motion. This means they can resume daily activities that they previously found challenging, climbing stairs, walking longer distances, engaging in recreational pursuits, and even, in some reported cases, returning to athletic training without that prior debilitating pain. While, as I mentioned, some early relief might be felt quite quickly, sometimes within 24 hours for a few individuals, the most substantial and optimal benefits typically manifest between that 4 to 12-week window as the hydrogel fully integrates and the joint environment responds positively.
That 5-year mark for a single injection, which you touched on earlier, that really is quite remarkable. Is that from specific studies that are still ongoing, or is that fully published data now?
Yes, absolutely. There are ongoing prospective studies, and the initial findings from those continue to reinforce this potential for long-term benefit. They indicate that patients can experience sustained benefits up to 5 years after a single injection. These studies are showing notable reductions in pain scores and consistently improved mobility over that extended period. Initial assessments conducted after just 1 year already demonstrated profoundly positive outcomes, and these seem to be largely maintained at the later time points being assessed. This sustained effectiveness data really does position arthrosamid as a potentially durable solution in our orthopedic toolkit. It moves us closer to a long-term management strategy rather than just episodic treatment for flare-ups.
And the safety profile alongside that efficacy.
Regarding its safety profile, it's notably reassuring, actually. Clinical studies conducted so far, which encompass a significant number of patients now, have indicated no serious adverse events directly associated with the treatment itself. That's a critical finding. Most of the reported side effects have been, as we discussed, mild and transient. This affirms a high level of tolerability among patients. These are typically those temporary injection site reactions, a bit of pain, swelling, stiffness. The studies also highlight a very low incidence of complications overall, which again underscores the importance of having experienced healthcare providers administering these injections effectively, which is why that ultrasound guidance is so critical for safety as well as efficacy.
Patient safety and comfort are absolutely paramount. If we put arthrosamid's safety profile into the broader context of other joint interventions, how does it really differentiate itself? Especially in what seems like an increasingly crowded market? What are the common reactions, the rare complications, and crucially, how do we advise patients to manage them?
That's an excellent question, and it's really where arthrosamid does appear to shine, particularly when you compare it to, say, repeated corticosteroid injections, or perhaps even multiple rounds of hyaluronic acid. For the common reactions, as we've said, patients typically report temporary pain, maybe a feeling of fullness or some swelling, general discomfort right at the injection site. These are almost universally transient, usually settling down within a few days. You might also see slight bruising, a little redness, or perhaps an initial feeling of warmth at the site as the body adjusts. We advise patients that if these symptoms persist beyond a few days, or if they seem to worsen, they should definitely get in touch with their healthcare provider. For managing these common side effects, the practical tips are straightforward. Applying ice packs to the injection site can help reduce swelling and discomfort. Using over-the-counter pain relievers as recommended by their doctor, paracetamol, perhaps ibuprofen can be helpful. Keeping the injection area clean and dry minimizes any tiny risk of infection, and maintaining that open communication with their doctor about any unusual or persistent symptoms is always crucial.
Okay, so manageable local reactions mostly. How does that compare to something like corticosteroids then?
Well, when we compare it with corticosteroids, the differentiation becomes much clearer. Corticosteroids, while very effective for acute pain and inflammation in the short term, do carry that potential for increasing blood sugar levels. That's a significant concern for many patients, especially those with diabetes. They also pose a risk of local tissue damage with repeated use over time. Things like cartilage degradation or even tendon weakening have been reported. And they don't offer that same long-term mechanical cushioning and integration with the joint's own tissue that Arthrosamid is designed to provide.
So Arthrosamid avoids those systemic effects and potential long-term tissue issues associated with steroids.
Exactly. Arthrosamid, in contrast, aims for that long-lasting relief without the same degradation or the systemic effects seen with repeated corticosteroid use. Its non-absorbable nature means it stays put and functions as intended, providing sustained support without being broken down by the body. So this durable local action, combined with a generally mild and transient side effect profile and the absence of serious systemic adverse events reported in the clinical trials so far, truly sets it apart. It makes it an intervention designed for prolonged benefit without the cumulative risks associated with more frequently administered or potentially systemic alternatives. This really positions it as a very attractive and distinct option for patients who are seeking durable relief from their NEOA.
And the rare complications. You mentioned infection or allergic reaction earlier.
Yes, regarding rare complications, though infrequent, they can occur. The main ones would be infection, which is a risk with any joint injection or potentially an allergic reaction to a component. This again just emphasizes the critical importance of skilled administration in a sterile environment and that close post-procedure monitoring. We always alert patients to the red flag signs of potentially severe complications. Things like increasing redness that spreads rapidly away from the injection site, significant or worsening swelling that extends beyond the immediate joint area, or intense pain that doesn't improve with standard pain relief and might be accompanied by a fever. If any of these occur, prompt medical attention is absolutely necessary. Patient education on spotting these red flags is paramount for safety.
Let's widen the lens now, thinking about the regulatory landscape and the path to broader adoption. What's Arthrosamid's current regulatory status, particularly thinking about key agencies like the FDA in the US? And what are the implications of this for access and practice globally?
Okay, so Arthrosamid is currently well into the process of seeking FDA approval in the United States. This signifies an incredibly rigorous evaluation. It involves extensive lab research, preclinical studies, multiple phases of human clinical trials, all designed to thoroughly assess the product's safety, its effectiveness, and the consistency of its manufacturing quality before it can be made widely available there. The FDA process is, as you know, considered a global benchmark, so progress on that front is very significant. Beyond the U.S., Contura, the company behind Arthrosamid, is also actively pursuing, and in many cases has already secured regulatory approvals in other key international markets. That includes places like Australia, Canada, and numerous European nations where it already has CE marking. This comprehensive international approach is designed to ensure global access while obviously adhering to diverse local regulations and standards aiming to maximize patient reach. The wealth of clinical studies and the real-world data generated so far really forms the fundamental evidence base that underpins this ongoing regulatory evaluation worldwide.
And what would approval from agencies like the FDA mean, both for patients and for healthcare providers?
For patients, FDA approval provides access to a treatment that has undergone the absolute highest level of scrutiny for both safety and effectiveness. It really instills immense confidence in its use, knowing it has met those stringent quality and performance criteria. For healthcare providers, it offers a new, rigorously validated therapeutic option for managing knee osteoarthritis. It significantly enhances the range of tools we have available for patient care. It broadens our orthopedic toolkit, essentially. It allows for more tailored and potentially more effective long-term strategies. Ultimately, it empowers clinicians to offer a durable alternative in cases where conventional methods might have fallen short. It really would signify a major step forward in the non-surgical management of OA.
Moving beyond the clinical trials and the regulatory side, the real impact is often best understood through individual patient stories. What are you hearing from patients who've actually had arthrosamid injections? What are their experiences of renewed mobility like?
The feedback from patients has been, well, overwhelmingly positive and actually quite moving in many cases. There are numerous testimonials available now, with individuals sharing really heartfelt stories of significant improvements in their daily activities and a profound renewed sense of mobility. We've heard reports from patients overcoming long-standing knee discomfort that had severely limited their lives. They often cite a remarkable improvement in their overall quality of life. For instance, we hear about patients who are really struggling to climb stairs, now enjoying hikes with their families, or perhaps individuals who'd given up running due to pain, now being back able to exercise or play golf again.
So it's enabling them to get back to things they enjoyed.
Exactly. And this promise of potentially intervening earlier with Arthrosamid, combined with the use of cutting-edge technology like ultrasound for precise delivery and creating personalized treatment plans, it seems to be leading not just to symptomatic relief, but perhaps to truly better overall outcomes, potentially delaying or maybe even preventing the need for more invasive joint procedures further down the line. Patients are, of course, consistently encouraged to adhere to the aftercare guidelines to optimize their recovery. Their proactive engagement plays a really significant role in achieving and sustaining the benefit. And the improvement isn't just physical, it often seems to be psychological and social too, allowing them to reconnect with activities and people they care about.
Are there any particularly striking long-term anecdotal cases, perhaps demonstrating relief even beyond that 5-year mark from the studies you mentioned?
Yes, absolutely. There's a growing body of real-world anecdotal evidence emerging now, particularly from clinicians and patients in Denmark, where arthrosamid has actually been in use for a longer period. These reports suggest that many patients are continuing to experience profound positive effects from their arthrosamid treatment, even 5 to 8 years after their single injection. Now, while anecdotal, this really underscores its potential for truly sustained, possibly decade-long, management of knee osteoarthritis symptoms from just one intervention, which is an incredibly exciting prospect in managing a chronic disease like OA. Furthermore, the availability of comprehensive patient support resources, things like downloadable information leaflets, exercise guides coupled with consistently high patient satisfaction ratings being reported by clinics offering the treatment, it all suggests a positive overall patient experience that extends beyond just the immediate clinical interaction. It really seems to be a testament to the treatment's ability to genuinely impact a patient's life long term.
Now, every significant innovation inevitably brings its own set of scientific discussions and questions. It's crucial we acknowledge these for a balanced view. What are some of the ongoing points of scientific inquiry, or perhaps areas the community is still researching regarding arthrosamid, and what does the future really hold for this treatment?
You're absolutely right. No innovation exists in a vacuum without ongoing scientific scrutiny. That's a healthy and essential part of medical progress. There are certainly ongoing debates and vigorous research concerning the precise biological mechanisms by which the hydrogel exerts its long-term effects. While we understand its mechanical properties well, the cushioning, the integration with the synovial membrane, the exact cellular level interactions are still being explored. For example, whether it actively promotes any form of tissue regeneration or repair beyond simply acting as a passive scaffold is an area of intense research interest. And while the initial studies looking at sustained outcomes are highly positive, the medical community naturally continues to seek even more comprehensive long-term data, particularly from larger independent multi-center studies with very extended follow-up periods to further solidify the claims of sustained improvement over, say, decades.
So mechanism of action and very long-term data are key areas.
Yes, precisely. There are also sometimes discussions around the generalizability of findings from some of the earlier study populations and the ongoing need to ensure that patient expectations are managed realistically. As a relatively newer treatment compared to, say, joint replacement, it's vital to ensure that marketing and communication remain balanced. Highlighting the benefits, yes, but also clearly outlining what the treatment can and perhaps cannot achieve for every single individual. This is a standard part of integrating any novel therapy responsibly into mainstream practice. The call for more robust, independent clinical trials with diverse patient cohorts and very long follow-up periods is a consistent theme, and indeed, such studies are already underway or planned.
And looking ahead, what does the future hold?
Looking ahead, the future for arthrosamid appears exceptionally promising, I would say. There's significant ongoing research and development aimed at refining its application and understanding. A major new NHS study, for instance, is currently underway here in the UK at the Robert Jones and Agnes Hunt Orthopaedic Hospital NHS Foundation Trust, a world-renowned orthopedic center. This study aims to further confirm arthrosamid's efficacy within a large, real-world UK patient population. And crucially, it aims to identify specific patient markers, perhaps biomarkers, or clinical profiles that predict who is most likely to have a very positive clinical response. That kind of information will be invaluable for optimizing patient selection criteria, ensuring that those who stand to benefit most are identified and prioritized, which also, of course, contributes to cost-effectiveness within healthcare systems.
And technology, will that play a role?
Almost certainly. The integration of advanced technologies like motion artificial intelligence, or MAI, is also expected to play a crucial role in its future. You can imagine AI analyzing a patient's gait patterns, their joint loading characteristics, perhaps predicting optimal injection sites or personalizing rehabilitation protocols after the procedure based on their movement. This level of customized treatment planning and precise monitoring could potentially further enhance effectiveness and patient outcomes down the line. Ultimately, though, continued robust collaboration between healthcare providers, researchers, and industry stakeholders is essential. These ongoing studies not only validate the treatment's effectiveness, but also pave the way for further research initiatives, maybe exploring potential expanded indications, and facilitating the wider integration of arthrosamid as a standard treatment option in orthopedic care for chronic knee osteoarthritis. It really does represent a genuine shift in our ability to offer lasting relief.
That has been an incredibly insightful deep dive. Let's try and distill everything we've discussed into just a few key takeaways for everyone listening. First, Arthrosamid represents a truly novel approach. It's a non-biodegradable hydrogel, offering the potential for long-lasting pain relief and functional improvement for moderate to severe knee OA. It really stands apart from traditional injectables like HA because it isn't absorbed by the body. Second, its unique composition, that precise blend of water and cross-linked polyacrylamide, allows it to integrate with the joint lining, acting as a stable, persistent scaffold. This promotes lubrication and protection, with compelling clinical data supporting its effectiveness for up to 5 years, potentially longer, after just a single injection. Third, while it's generally well tolerated with mostly mild transient side effects, understanding the meticulous patient selection criteria, the strict indications, and the importance of appropriate post-procedure care is absolutely paramount for achieving the best outcomes and ensuring patient safety. And finally, despite the ongoing regulatory processes and the healthy scientific discussions around very long-term data, significant research is actively underway. That includes a major new NHS study here in the UK. This work aims to further solidify its role and refine patient pathways. The future likely involves enhanced patient selection using advanced diagnostics, integrating technologies like motion AI for more personalized care, and continued collaborative efforts to establish arthrosamid as a standard long-term treatment option in orthopedics. Thank you so much for sharing your expertise and insights during this deep dive. Your clarity and analysis have been truly invaluable. And for everyone listening, if you found this deep dive valuable, please do consider sharing it with colleagues who might benefit, perhaps on LinkedIn or X. And please take a moment to leave us a rating wherever you listen. It genuinely helps us reach more professionals like you. So here's a final thought to leave you with. As orthopedic innovations like Arthrosamid continue to reshape patient care, how might embracing these novel long-term solutions fundamentally alter our whole approach? Not just to treating chronic conditions, but perhaps even towards preventative joint health in the coming decade.